obviously we need to talk about this stuff in regards to antibodies versus I just explained to you a functional test. Now we're going to go through and we're going to look at actual immunoglobulins. So a lot of people will do sort of immunological screen tests. So they'll actually look at a bunch of infections and see if there's any IgM or IgG antibodies. And so look, for an IgM, obviously that's a recent or acute infection. And that's what it means. Okay. We're not talking about necessarily with ELISpot testing or some of the testing that's functional right now. We're not really talking about is it or is it not that per se. Obviously, IgM is important. The clinical history is important. But when we start looking at these functional tests, where we're looking at communication and then the percentage of function, we're looking at how is the immune system actually responding to that infection. One of the things that happens here, and you can get all kinds of different opinions on this, when you look at IgG levels, a lot of people will measure IgG levels and they'll say there's an infection here and the IgG is really high. And there's some really interesting strategies to try to utilize IgG at determining how well the immune system is actually doing. But it really, it's just, I mean, obviously, if you've had a vaccination, you're going to have a memory response there. So that's your long-term humoral immune response to some of these infections. But it's just going to really indicate if you've had prior exposure. And a lot of people have had prior exposures. So has somebody had a prior exposure, that's fine. You can look at that with IgG. And I really like to do immunoglobulin tests before we do an ELISpot test or some of the interferon and interleukin tests that I was talking about just a second ago. But it doesn't really tell me that IgG test doesn't really tell me how well the immune system is functioning in the midst. So these IgG it can't distinguish between active and past infection. If you have an IgG, obviously that's going to say acute, but IgG can't do it. Okay. And it may really be there long after the pathogen's cleared out. So you don't know if there was communication against that pathogen and then if there's appropriate resolution in regards of looking at a functional matrix. Okay. So these are your conventional sort of IgG and IgM. IgA are obviously mucosal responses, and IgE is more related to mast cell degranulation. I'm going to put that off to the side and not talk about that right now. But when we start looking at the ELISpot, and that's a stimulation index, that's looking at, okay, the immune system has been stimulated to this particular organism. How is the immune system responding between interferon gamma and then interleukin and them working together? And eventually, is it exhausted or not, or is it senescent? There's things that we can look at on that. So this is looking at T cell release of, again, the interferon to a antigen. And then it's going to look at your T cell activity to it. You may have IgG responses to a bunch of different things. And that's just showing, it's just sort of looking at that prior exposure. But then when you look at the ELISpot test and the interferon gamma and the interleukin 2, it's really beautiful because it's going to detect that T cell activity. Is it appropriate or not? Is it doing the right thing? Because a lot of times they're not appropriate, and that the burden of the infection is going out of control, or the immune system so exhausted it leads to autoimmune disease or other types of chronic pathology. So interferon gamma, I was talking about that alone. It goes up with the with the immune system recognizing one of these infections. It can't distinguish memory or the effector phenotype, but it can tell you about the functional response to the antigen. Okay. And so that, and as we go down a little bit further, then looking at, this is interferon gamma. Now, as we look at interleukin 2, it's going to suggest, are you getting that appropriate memory T cell activation to the initial stimulating event? And is it resolving appropriately? Is it sustained, or is it inappropriate? So that's why we're comparing the interleukin 2 data to the interferon gamma data. Okay. And this is just kind of showing you a little bit of the difference between these two. As we go to this, it's really cool because we can look at somebody that's IgG positive, and people have these all over the places to a lot of different things. Anything that you've been exposed to in the past, maybe vaccinated against and stuff like that. Again, IgG is going to persist for years. The pathogen is no longer active, but the ELISpot then comes along and says, okay, wait a minute. We have immune activation of this and we're trying to deal with it, or we're not. And so when we look at early infection, you may have that IgM. Anybody that has an IgM sort of response, I mean, you probably need to take that, seriously in regards to possible acute infection. But then if you look at that interferon gamma, and there's T cell activation of this, and it may occur. This is what's interesting. You may have the interferon response and the T cell activation before the detectable antibody production actually happens in this. Okay.